I began to notice about 25 years ago that a bunion was developing. It got worse over the 20 years. I hesitated having the surgery because sometimes you were told that you were trading pain for more pain. At 72 years of age, I decided that I should do it now or I wouldn't do it. And it did become quite painful.
The condition of a bunion is when you have this big bump on the side of the big toe here, and that can be painful over time, like yours, that it gets gradually worse and worse. What we're going to talk about today is the mini-bunion, or the minimally invasive bunion surgery. This is a revolutionary technique that takes advantage of surgery done through a small, tiny 1-inch incision versus the big, long incision that's the traditional surgery. The mini-bunion procedure is a minimal incision surgery that involves aligning the toe in 3 dimensions and less surgery, so therefore it's a quicker recovery.
Prior to learning about the mini-bunion procedure, I had a bunionectomy on my right foot, and the recovery was much longer and there was more significant pain. The doctor kept me coming back every other week for about 3 to 4 months. So there was a much longer recovery.
The surgery itself is outpatient surgery, so you can come in and leave the same day, outpatient surgery, and what's great about it is you can walk right away. You're in a surgical sandal, one of those Velcro shoes, and you can walk right after surgery. The time in the surgical shoe is about 4 to 6 weeks, depending on how the healing goes, and then you're back to a sneaker. So this is a pretty quick recovery. The other special thing is that it's not so painful, meaning the traditional bunion surgery with a bigger incision was much more painful than this type of procedure called the mini-bunion procedure. This is all through a small incision, which allows the surgery not to be as painful, allows you to get back on your feet quicker, and again, walking sooner than what the traditional bunion surgery was. Patients are rather surprised by the outcome of the surgery, whereas they take ibuprofen or acetaminophen, but don't really need the strong painkillers. So typically, maybe a day or two that they're pretty sore and may need these pain medicines, but after that, not really necessary after a few days. So it's not so painful as compared to kind of the traditional open surgery. One of the great benefits of this procedure is the function. You're able to do your golf, your tennis, your walking, working out, and that's a big benefit of this procedure because you don't develop near the scar tissue as the traditional surgery, and you can be active early in the recovery, but also much more active after recovery because you're able to do the things you couldn't do.
My recovery was quick, painless. I did not take any pain meds, although they were offered. I never needed a pain med. The first week, I elevated my foot. I followed all his instruction. From the first week on, I was mobile. I stayed in my shoe, orthopedic shoe. I absolutely had no pain, no discomfort, and was mobile after the first week. It has been 5 months since my surgery. I am in full activity. I play golf once or twice a week. I walk 2 miles a day. I work out with a trainer. I am at full mobility. What I would say to any patient who has a bunion and is experiencing pain and is apprehensive about having the surgery, do not wait 20 years as I did. It was painless, the recovery was short, and your activity level is much better once the procedure has been done.